As a glaucoma specialist, I have words of advice that I'd like to give to every glaucoma patient. Words of advice that I think over the years I've gathered and feel that each patient should know to better take control of their disease. Glaucoma is an eye condition that, if left untreated, will lead to blindness, and that blindness is irreversible. We know that 50% of people who have glaucoma are not aware that they actually have the disease. And we know that people who are aware that they have the disease still struggle with trying to live with glaucoma and take care of it. Imagine that you lost your vision today. What would you miss most? I want you to take a moment to write it down. Would it be that you would miss your family, seeing their faces, the memories that you remember having with them? Would it be certain sights that you've seen? Maybe you've traveled around the world and seen certain beautiful scenes. Or maybe it might be your independence, being able to take care of yourself, walk without fear. These are things that could actually go if your glaucoma is left untreated. And so I want to reach out to those people who have either been recently diagnosed or people who are struggling with trying to deal with their glaucoma. Some top pieces of advice from a glaucoma specialist to the patient. 1, accept the disease. When you have been diagnosed from a trusted doctor that you have glaucoma doesn't go away. And glaucoma won't go on pause just because you're not ready to accept it. Staying in denial will not help slow down the disease. If you're able to accept the disease, now you can actually take control of it and do something about it. You have to be your own advocate, okay? Number 2, you need to show up and be present. What that means is that you need to follow up with your regular exams. Even if your glaucoma seems to be doing fine and you're under good control, glaucoma can change. And it can change without you knowing it. It can become more aggressive, the drops can stop working, or the treatments that you have can stop working, and there might be need for more aggressive treatments. And if you don't show up like you're supposed to regularly, things can change and you can't go backwards. So you need to show up. 3, you need to speak out. And speak out means you gotta be present and ask questions. Okay, it's your eyes, and you don't want to just go to the doctor and say, okay, and not know really what's going on. It's okay to ask questions. It's okay to ask the doctor, am I on target, or has anything changed? It's good to ask those questions so you know, because the more that you understand what's happening with your own eyes, the more that you can try to stay on top of it. Okay, and then also speaking out means speak out to your family members. Your family members are also at risk because you have it. And if you don't tell them, you're actually doing them a disservice, because the earlier they find out, the easier it is for them to treat it. And you want to be able to give them the gift of sight. You know that you have it, and you might not have known that you had it when it was first diagnosed. You can imagine that they might not either. So allow them to know by you sharing that information with them.